About 7 years ago, myself and Dr. Osborne came up with an idea to organize a concert to raise funds for the hospital. We decided that we will raise funds using the creative talents of the students from the Windsor University who use the institution for their clinical education. Instead of sitting around and complaining about what we didn't have, we decided we will augment what we had. That was the birth of the annual Windsor Joseph and Franz General Hospital concert. For 5 consecutive years, starting in 2012, we hosted a concert and the funds raised were put to good use. We repainted the emergency room, we placed fans over the beds on the surgical ward to help our patients through the hot summer days. We placed otoscope and ophthalmoscope units on all the wards, emergency room, and the outlying institutions to facilitate INA exams. We bought equipment to set up an EKG center in the outpatient department so patients could come and have their hearts checked. We purchased a total of 28 EKG monitors, placing a monitor over every single bed in the recovery room so our post-op patients could be adequately monitored. We placed a cardiac monitor in the emergency room, the surgical and medical and maternity and private wards, the intensive care unit, and in every single health center across the island so all of our patients could be properly monitored. We also purchased 4 new cardiac defibrillators that were placed in the emergency room, the operating theater, the medical and surgical ward, and the Poxon Hospital, so that if patients had an abnormal heart rhythm or if their heart stopped, it could be jump-started. And we placed 2 large air conditioning units in each of the main operating theaters so that surgeons, nurses, allied staff, and patients could work or be worked on there in absolute comfort. Before the start of our last fundraising concert 2 years ago, I said at a ceremony like this one that we had plans to raise over $100,000 to purchase an ambulance. Some doubted our commitment to this endeavor. I am here to tell you, however, that raise it we did, and as proof you can look to your left and see the brand new ambulance. I also want to thank Social Security, who you will hear from later, for coming on board and purchasing a second ambulance, which means that today we will be adding 2 brand new ambulances to our fleet. This would not have been possible without our major sponsors. I first want to say a big thank you to our gold sponsor, Christoph Haber and Buddy Darby, who sponsored us to the tune of $20,000 or about 54,000 EC dollars, which is about half of the contribution that was raised towards the ambulance. Our silver sponsors, the St. Kitts Nevis Anguilla National Bank and the Development Bank, who've been with us for the last 5 years, give them a round of applause. The National Caribbean Insurance Company, and for this one I want a big round of applause also, the Cricket Association, because they came on board very early and gave me their huge check. Congratulations. The University of Medical and Health Sciences and Windsor University. The other sponsors include Nagico Insurance, First Caribbean Bank, Scotia Bank, Island Bakeries, the Football Association, Mojitas, St. Kitts Biomedical Research Foundation, St. Kitts Biomedical Magnetic Resonance Imaging, and IAS Diagnostic Repairs. Their financial contributions were invaluable to our effort. Give them all a round of applause for this worthy and collaborative effort. The emblems of our major sponsors were placed on the ambulance so that the public will know that these are the companies that made a significant investment in our healthcare system. I also want to thank some other persons or organizations who made a significant contribution in kind. I speak of Adrian Lamb and Toucan Sound System, who every year provided his sound system free of cost for the concert. Loftus Lighting for his professional lighting display that brought the stage to light on the concert night. This is a job that his company does free of cost every year. Give him a round of applause. And the St. Kitts Marriott for giving us the Sabre Room for all of our practices and for the final show free of cost. The ones who deserve the greatest round of applause are the Windsor students who took the time out of their busy academic schedule to make this possible. They're seated in the back. Now, most of the students who made the greatest sacrifice for the betterment of our healthcare system have already left the island, never to return. They made this sacrifice, however, for you and me who use the institution on a regular basis, and we commend them for their sacrifice and selfless contribution. I want to encourage our current sponsors to stick with us and ask other institutions to come on board to help make this sacrifice and this commitment a good one. It's only in doing this concert I realized how difficult begging is. Despite the fact that we have a lot of persons who came forward and we're congratulating them, we got a lot of turndowns. But it's important to realize that this contribution was significant because these ambulances would be helping those who contributed and those who don't. And so I'm hoping in the future we can expand our sponsorship. I also want to say a big thank you to our nursing staff who placed their orders for tickets to support the event months in advance. The room was practically sold out by the staff and their families before we could even sell to the public. So give the hospital staff a round of applause. Your contribution made today a reality. I thank all the doctors from our medical fraternity who supported this worthy cause. Lastly, to the AMS staff, I urge you to take good care of these 2 ambulances as you rush through traffic, tended emergencies. They are a gift to your department, but one that was obtained through hard work and sacrifice. So please treasure them and take care of them as if they were your own. I thank you very much.
It is indeed a great honor to stand here on behalf of the Social Security Board of Directors to demonstrate our continued commitment and to the delivery and advancement of healthcare throughout the Federation of St. Kitts and Nevis. Today in particular, the Social Security Board is elated to officially hand over 2 conversion ambulances to enhance the emergency response capabilities of the Joseph N. France Hospital. This significant sum totaling over $500,000, but in particular $568,183,000 represents a little over 2 years' worth of donations to the healthcare, as each year $270,000 is especially allocated for contributions such as this. However, we take great pleasure in honoring this special request, an additional sum, because we do recognize the importance of having functional, fully loaded and technologically advanced ambulances as a part of our fleet. Thus, it was necessary for these vehicles to be purchased and to be commissioned to meet the needs of those requiring emergency care, especially in this environment, fast-paced, and an environment that has become very complicated. Further, we are certainly cognizant of the correlation between good health services and a healthy workforce. We have experienced the impact of sickness and other health-related contingencies on the insured populace, and how the loss of income by an insured member can negatively impact the base of our fund and the broader economy. For this reason, we have pledged our continued commitment in making tangible investments in the sustainability of an effective and efficient healthcare service by donating well-needed equipment to boost the capabilities of our hospitals and other healthcare facilities. Additionally, we implore the general public to become advocates in promoting a culture of wellness, in fact a culture of peace as well, by taking advantage of the services offered by the Ministry of Health and by undergoing annual examinations with the medical service providers for preventative care. as they all say, the health of a nation is the wealth of a nation. So, on behalf of the Minister of Social Security, Board of Directors, the Directorate, Management and Staff, we present these ambulances to the people of the Federation of St. Kitts and Nevis. May they serve us well. And by way of a light moment, fortunately, and let me not board, I have never been a patient in this hospital or any other hospital. And I've never gotten a ride in any ambulance. And I hope it remains that way. Thank you very much.
I wish to join with all of the other previous speakers here this morning to say how delighted the Ministry of Health is to be on the receiving end of what I consider to be a very generous donation to the advancement of healthcare in St. Kitts and Nevis, specifically to our institution-based healthcare system as we continue to build out the emergency medical response in the Federation of St. Kitts and Nevis. Now, today's contribution perhaps brings to a total 5 ambulances available for us in St. Kitts alone. There were 2 prior ones and a donation from Mr. Al-Ghanim just about a year ago, and then now these 2 buses. This is a welcome improvement for us because what we want to see ideally is that each of the hospitals in St. Kitts has at least 1 bus in the case of the 2 outposts, Parkson and Mary Charles, but then to have at JNF, because of the sheer size of coverage provided by this hospital, which is basically ground zero for emergency care, that we should have at least maybe 3 or 4 buses assigned here, and fortunately be able to build in some redundancy so that you allow for downtime for the ambulances, so that you don't wear out one over the other and so forth. So we are getting to that mark. But at the same time, as I was pondering how far we have come in terms of public health care in the Federation, starting from perhaps maybe a post-World War II era, like after 1945, I can tell you that St. Kitts had 1 ambulance. And that 1 ambulance would have been donated by the late Dr. Norman Kramer. It was not a new vehicle, but it was in fairly good condition. The National Archives would have provided us with a photo of that bus. Simple little van with wood paneling, so you could understand what we're talking about then. And in those days, you didn't have too many manufacturers of vehicles at the time, so most of them would have been like Wolseley and Austin vehicles. Some of you here don't know what that is, but those are older models that predate the newer types, such as Mazda and Mercedes and so forth, that we now enjoy today. So it goes to show you that the whole history of the development of healthcare in St. Kitts and Nevis did not happen independently of private sector support. It has always been a partnership because of the limited resources we have as small island developing states. While we can also boast and indicate that, for example, in St. Kitts, we have now surpassed the PAHO recommended quota of having more than maybe 6% of our annual budget dedicated to healthcare, because we now have approximately about $62 million per year that goes into healthcare for a federal budget that is probably just under 800 million. And it is something to be proud about in a population with a small tax base that only has about 50,000 adults, which means that the bulk of the population are either children or the elderly still, or not paying taxes as you would expect from a fully built out tax base in a mature country. So we are still grateful for the strides that we are making, but I have to single out the efforts of the donors who would have contributed to the annual fundraising concert that Dr. Wilkinson would have put on every year, specifically Christoph Harbour, the other donors, Development Bank, and so forth. And of course, while Dr. Wilkinson is here listing off all of the philanthropic mindedness of the Windsor students, he forgot to tell you his own role in the concert. Because I do recall quite vividly the first concert I attended once I became Minister of Health in 2015. The good doctor was one of our Chippendale models. And I cannot forget that. And he did it well. And then I think the following year, it was almost like a reincarnation of what you might have seen with some of your VH1 or other types of videos, BET, when he actually was half dressed for the entertainment of the ladies. And that went down very well as well, all tastefully done. So I commend Dr. Wilkinson because his selflessness continues to amaze us in the Ministry of Health in terms of how far he would go ever since returning home to the Federation over 20 years ago to give back to the country of his birth. So Dr. Wilkinson, I thank you sincerely. Now, if I could go on to Social Security, Mr. Maynard gave in a nutshell the idea of how contribution is given to the Ministry of Health when it comes to Social Security. And what I would like to explain by way of definition is that when it comes to Social Security, apart from what they give to various endeavors throughout the length and breadth of the Federation, it had been a long-established practice going back a number of years where Social Security would contribute the sum on its own of about $100,000 to be shared between St. Kitts and Nevis when it comes to health care. $30,000 for Nevis and the other $70,000 to be spent on St. Kitts. So essentially the donation to which he refers this morning, which is exactly $570,549 towards the bus, represents 3 years of contributions if you multiply 70,000 times 3. So Mr. Maynard, thank you sincerely for that ongoing contribution. It means a lot to us. Together we can tell that we have just over to our right or left, depending on where we are standing, 2 pieces of wheeled equipment that cost well over $500,000. And now I speak to the EMT team that we have here, our emergency medical technicians. The cost of emergency medical care in this country or any other country is not cheap. These buses, as old folks say, don't cost penny halfpenny, okay? It means that we have to look after them. It means that while it might be true that you're driving under emergency conditions in the goal and the hope of extending life and preventing death, road safety is still a priority that we have to pay attention to. And we also have to pay attention to agility on the road and diligence on the roadways as well. It also means looking after the buses in downtime, that you don't use the bus or abuse the bus for personal use and things like that, taking chances in traffic that should not be taken, because then the claims against the government are going to increase, and it then negates all of the good investment that would have been placed into the provision of these buses. So please look after them well. Our civil services such already that once the traffic department can identify that the cause of accidents would be persons driving vehicles whether or not they're government employees, it is still a liability on the part of the government if it is a government driver who is in the wrong. And it then means that if it is a result of carelessness, guess who is going to pay to fix it? Okay, I will say no more on that topic. But I will just ask us to be kind to the vehicles, to be kind to other motorists on the road. And at the same time, to the motorists in general, we have to keep reinforcing the messages of road safety, that they too begin to be resensitized, or in some cases sensitized, that when you hear an emergency vehicle, you get out of the way. You try your best to pull over and you get out of the way, because the life that is being saved might be one of your relatives. And that is something that we are having a problem with in the ministry, with the traffic department, where the ambulance could be bawling a half mile ahead and nobody moves out of the way. I have seen it happen time and again. And this is something that we would like to get our people to have a renewed sense of appreciation for, in terms of ensuring that whether it's the ambulance or fire services or the police, please pull over and get out of the way, to let the business of the state continue in the effort to save lives and to change what would otherwise be adverse outcomes that cannot be rectified. Now, I noticed Mr. Maynard spoke also about the role of Social Security in assisting with healthcare delivery, but also in responsiveness. And we in the Ministry of Health would like to use every opportunity we have, once we have the microphone in front of us, to remind us all about the challenges that we are facing in this country when it comes to non-communicable diseases. It is responsible for 83% of our deaths. It is the leading cause of morbidity in our country. By extension, it also means that perhaps maybe 50 to 80% of the ambulance calls that are received for us to respond to might be related to NCD accidents. It could be strokes, it could be heart attacks, you never know. Diabetic coma. And of course, it ripples out into all of the areas of our lives when we think about it that way. But for Social Security, it is also in terms of the payout when it comes to benefits for illnesses. Because I'm sure if Mr. Maynard would come back up here and he was to do the tally, most of the payouts that Social Security continues to make are for NCD type disability. Isn't that the case, sir?
That's right.
Exactly. Yes, you know, you have your regular run-of-the-mill things like your contribution to funerals and so forth, but they pale by comparison to the colossal sums that are being paid out in terms of insurance benefits for disability, amputations, whatever might be the case. So we have to get the message across to ourselves and to our people that we need to look better care of ourselves. Eat better, have better checkups. We have the fortunate situation of having our Prime Minister be the CARICOM lead head for health. Just 2 weekends ago, we would have launched the St. Kitts Nevis chapter of Caribbean Moves called SKN Moves, which is about good diet and lifestyle and making sure you stay on top of your checkups. And we would like to advocate for that, because if less money has to be paid out of Social Security and out of the health system for the maintenance of care for persons who, if they took better care of themselves, the funds wouldn't have to go there. Those savings could go elsewhere into other areas of human development that we would like to see this country advance to. So again, I appeal to all to do our own individual part and collectively to continue to work towards the goal of providing the people of St. Kitts with the best type of health care possible. Again, as I close, I wish to say a sincere thank you to all of our donors here this morning, and to tell you that we are indeed grateful for the contribution that you've made, and we would wish this partnership to be enhanced from strength to strength. Thank you for your time.
It is indeed a privilege, a pleasure, to be part of this important and historic occasion, which I will describe as a special day when healthcare services is rolling up its sleeves and getting an injection. Just over 4 years ago, when the Team Unity administration was asked to lead this great nation of St. Kitts and Nevis, Minister Phipps and I were charged with the responsibility to chart the course of healthcare services delivery at the federal level. We recognized immediately, among other things, the need for investments in the physical plant, equipment, technology, and human resources if we were to achieve any improvement in the disease burden then identified in our federation. PAHO's recommendation that countries should make provision for up to 10% of its population with mental, behavioral, and degenerative disorders gave rise to our need for supporting mental health, and we established a mental day treatment center. We delivered on that as a government. We know the work undertaken there and those who benefit from it. If you think about it, if 10% of your population is to be catered for some form of mental disorder, that's 1 out of 5. 1 out of every 5 persons. How many of us are here? Start counting. The fifth person next to you might be someone who can be categorized as being in that category. Let me see, I'll start up there, or I'll start down here. And then, of course, in 2012, the statistics showed that 90 additional persons were diagnosed with cancer. It fell off a bit after 2012. And that gave rise to the need for an oncology unit to be established in the Federation, because prior to that establishment, persons were forced to travel to Trinidad and other regional and extra-regional places to be served by those who work in oncology units. That was an important delivery by the Team Unity administration as we built out the health infrastructure and the resources that we needed. We agreed with WHO that a well-functioning health system has 6 pillars: stewardship, financing, quality orientation, competent workforce, adequate inventories, and a robust information system. We therefore set out and set about delivering a robust information system and supporting what had commenced before, in collaboration with our oldest ally, Taiwan. And in January 2016, we delivered at this institution a more than adequate set of computers and software to be able to help us to build out that information system, so important to comply with what WHO says is one of the pillars of a robust and well-functioning health system. This effort was geared towards strengthening the management information system. It was done so in keeping with the pillars. And while I have not been close to it recently, I am confident that those who are working to build out that information system will achieve the goals set by the ministry. Further, recognizing the dilapidated conditions of Mary Charles Hospital, for example, situated in Molineux, where roof ceilings were falling down, we commissioned a complete overhaul and refurbishment exercise to restore that community facility, of which every service seeker, every health service seeker should be proud of. We delivered on that. No limits have been placed on education and training. Indeed, it was as early as 2016 that, recognizing the burdens faced by families, persons with renal and, of course, kidney diseases, a disease that could not only bankrupt a family, but a country, we know that providing service here could cost up to $130,000 per patient per year. I shudder to think that those of us without insurance would have to find those resources just to stay alive and to perform our normal duties. So what did we do? We delivered on that, in that we engaged our friend Taiwan again and instituted a 3-year program. The program involved training of our clinicians here and abroad, And of course, it involved the installation of new, modern dialysis machines to be able to deliver the quality services, quality healthcare services that a growing number of persons in the Federation needed and still need. Now, the list that I have mentioned is not exhaustive. It was never meant to be exhaustive. In fact, I have listed another 5 major projects that I could speak to as deliverables, what we have delivered in 4 years. But I ask you, however, just to permit me to briefly address one of the major developments that will be introduced as part of our overall delivery of services to be able to deliver healthcare services to the peoples of our nation. As part of the government of St. Kitts and Nevis's Fresh Start Prosperity Agenda, all the way back in 2016, both the Prime Minister and I outlined programs for improving access to care for the overall functioning of the health system. It was in keeping with our manifesto promise at page 18, where we recorded that within the first term of office, we will commission a comprehensive national health insurance plan for all citizens and residents of St. Kitts and Nevis. Renewed attention has been focusing on universal health because, of course, of the ongoing concerns and challenges related to the burden of diseases. I think Minister Phipps referred to some of those in her presentation. It was renewed because of the financing needs, because there is need for more sustainable and barrier-free access to health care. And of course, to ensure that there is a financial protection for individuals and families. And these concerns and challenges include, but are not limited to, gaps in accessing care, especially by those without private insurance. Gaps in the availability of tertiary care. Challenges to sustainability of health financing. Challenges with self-responsibility and cost sharing for one's health. Challenges with mixing service delivery, capacity, and quality of health service in the public and private sectors. And because of all that, we determined to begin to work diligently on our manifesto promise of delivering universal health insurance coverage to the Federation. I am pleased to tell you that on the 8th of February 2018, we appointed a commission to do the groundwork, to study and to recommend to Cabinet how to proceed. They were supported by a team from the University of the West Indies Health Economics Unit. They were charged to look at things like the benefits package, the beneficiaries who will be covered, financing options, administrative structure, and overall approach. And I'm pleased to tell you today, as it will be broadcast, I think, that we now have what we call a blueprint for the implementation of universal health, supported by an actuarial report that has showed us that based on the data collected and analyzed, we have a gap of about $83 million to fill to be able to deliver on universal health. We are at that point, ladies and gentlemen, where we can frame how and make a decision on when and how we will implement this program, whether phased or fully. That, of course, depends on all of us. That does not give us as practitioners, you as practitioners, because I'm not a practitioner, the license to double your charges to people, because we're not bankrupting our system. That calls for us to understand that we're dealing with ordinary people and in fact your own resources because you pay tax. And to be prudent, let me repeat, prudent when providing invoices for work done which will be covered by universal health. At this point, I want to express my gratitude. My gratitude and that of the government and people of St. Kitts and Nevis to Dr. Cameron Wilkerson. I want to do that not because, or not in his capacity as a doctor. That's much deserved, of course, but that's not why I'm doing it. But also because I saw and still see a different side of Dr. Cameron Wilkerson. And of course, my good friend here, who I saw as well, Osborne, Dr. Osborne. I saw that he was a leader in the performing arts. I had the occasion to visit at least 2 concerts. At least 2. I think they may have had 3. But I went to 2 of them, where the first-class talents of nurses, doctors, and students of the Windsor University were, or can be described as, talents fit for Broadway. I believe they would have shaken up Broadway if it was done on Broadway. Every now and again, when I want a good laugh, I play it back in my memory. And in 2016, for example, that effort by Dr. Wilkerson and those who supported this concert raised $48,363.56. I think I heard Dr. Wilkerson. I still have your note, Doctor. Referred to it earlier. $48,363.56. And then after some expenses, I wouldn't name who the expenses were, you went down to $45,264.51. And then, of course, when Cable and Wireless and Ross University made their contribution, you went up to $65,290.01. And I think that they should be commended for that effort in 2016. It was at that point that I was inspired, to be quite frank, even though I always have inspiration, to source some support from overseas. And with the help of His Excellency Isaac, tracking down Mr. Qutaiba Al-Ghanim. Sorry, that's not, no. With the help of his office, we were able to get a foundation from Germany to give us a grant of $50,000. And I now acknowledge and thank them for it. With that support, I think Dr. Wilkerson already gave you a list, but I recalled 25 cardiac monitors, 3 cardiac defibrillators, air conditioned units, and so on and so on. Quite a significant contribution that improved the quality of services at the Joseph N. France Hospital and our institutions across the country. In 2016, as I said, 48,000 was raised there. But that was only the beginning, because in the next year, when I went and enjoyed myself, I'm aware that for the first time, the organization crossed $100,000 raised from that event. And I think again, Dr. Cameron Wilkerson may have indicated some of the persons who contributed. 4 years ago, though, Wendy and I recognized that we were left by the previous administration a proverbial one-legged ambulance service. In fact, the island of Nevis operated with much more superior services, while we were going along with 1.5, they were motoring with about 4. And the effort we made to obtain 2 ambulances supported by Kuteb Al Ghanim, I'm still trying to work out how one got to Nevis. But I was expecting both to be here to bring our fleet to at least 3.5. One ended up in Nevis. So they got 5 when we got 2.5. And that's what we've been facing. We worked diligently to secure those ambulances. And that's why I'm so pleased today that the further effort of the group that performed so well over at Marriott, and with support from the Social Security, that we can today see 2 important ambulances, I'm told, are 2018 model. These are not reconditioned, these are 2018 model, built in 2018. And I agree with Dr. and the Minister that we ought properly to take good care of and treat with those ambulances. You have already heard from the director. So there's no need for me to expand on what he said about Social Security. But suffice, I will say, thanks to Social Security for living up to its commitment. With new administration, I think that we can now deliver services to the people of St. Kitts and Nevis. And you know, perhaps you should give the Social Security a hand, because they have done a good job. While one ambulance could be marked procured with resources from Social Security, the other would look really fine with resources procured by Cameron Wilkerson and his team. And so, Dr. Wilkerson and the team, if I didn't say it before, let me say how grateful we are, Minister Phipps and I, for the work put in just to be able to provide services to ordinary people of St. Kitts and Nevis. We want to thank you and encourage you to continue to do what you can. Lead, as you seem to have been always doing. Don't lose that ability to lead, so that we can provide services to the people of St. Kitts and Nevis. I therefore, at this point, thank all of you for coming, participating in this event, and to assure you that the government of Team Unity, Minister Phipps and I, are committed. Every day we work to commit ourselves to improve the service delivery in health.